Fundamentally, the job hasn't changed. I mean, the job of healthcare leadership today is to transform healthcare delivery so that people can get all the care they need and waste is minimized. There's also a trend nowadays, a happy one, to move toward determinants of disease, and I think healthcare leaders need really to be thinking about how to convert their own organizations into give them the ability to move upstream to generators of illness. That hasn't changed. I think the election will change coverage. There'll be some changes, I'm sure, with respect to how people get healthcare insurance. I think there may be a shift of balance between the role that the federal government plays and the role that states play. If anything, though, I think the quality movement and the importance of leaders focusing on quality goes up, not down now, because, in some ways because we might expect some decreasing of federal leadership for the quality movement, at least temporarily. I don't sense, nobody has a crystal ball, I really don't know what's going to happen, but I don't sense any backing away from the investment in moving from volume to value, from beginning to organize healthcare delivery and payment around what happens to patients. I don't think that'll change. So I'd say stay with it. This is a time for constancy around the agenda of improvement. IHI, the Institute for Healthcare Improvement, from its beginnings and now is focused on patients, people who need care, and that doesn't change. And so, I hope we use our own compass and keep organized around just helping to relieve suffering and meet the needs of people. And remember, IHI is global, so that a lot of the work that's going on in this organization and in the quality movement is really around the whole world, and that isn't going to change. Here in the U.S., we don't know about changes. For example, in the Affordable Care Act, there are very significant investments in helping care get better. Ways to measure care that we've never had before, commitments to transparency, direct support to innovation through the Center for Medicare and Medicaid Innovation, a lot of support for demonstration projects, a lot of latitude for states to try new things, big focuses on getting people out of institutions and into community supports. All of that is embedded in the Affordable Care Act. Most of the repeal and replace rhetoric that we're hearing about the ACA right now is about coverage. It's about different ways to cover care. I haven't heard much conversation about changing these essential elements of the ACA around the focus on quality, and I'm hoping that that constancy doesn't change. Everyone benefits, Republican, Democrat, patient, provider, everyone benefits when care gets better, and I hope those portions of the ACA stay intact. Particularly important one is these Centers for Medicare and Medicaid Services, CMMI Innovation Center, the Center for Medicare and Medicaid Innovation, that got congressional approval in the Affordable Care Act. It's the country's largest investment in history in supporting new models of care that we can learn from. And if we're smart, we're not going to give up on that. The country ought to have that investment in supporting innovation. I think it's a very important decision this new administration is going to make.